I just turned my video off.
CC, you will see like a selection for subtitles, show subtitles, and then you should be able to see the closed captioning at the bottom of the screen. So thank you everyone for joining us to our must-know worker safety and health standards related to COVID-19. We've had several trainings before this in which we talked about other standards, so please refer to those if you want to learn about more. Next slide, please.
So this webinar is being recorded. This is so that at the end of the webinar series, you will have access to this webinar to rewatch it. Click the closed captioning box at the bottom, as we mentioned, to get closed captioning. You have all been automatically muted, and please make sure you stay that way. Put questions in the Q&A function. The moderator will make sure the questions are either answered during the presentation. We'll have 2 breaks where we'll have question and answer portion. And if we do not get to your question, you will get an email from us. If you have comments that you just want to share with people, you can use the chat function. If you are requesting MCLE, you are required to take the survey at the end of the Zoom meeting. Next slide, please. So this is what it will look like when you exit the Zoom. Your browser should open up a tab in one of the web applications that you have open. You would select continue to fill out the brief evaluation. We encourage feedback from everyone, but require it from those seeking MCLE credit. And the last thing I wanted to mention was that if you did not receive an email from me with case study 1 last night, I will need you to email me first. I had a couple of issues with people's emails not allowing my email to come through because of your email server logged it as some type of spam. And I tried a couple of times to email you. So if you did not get an email, you will have to email me first in order to get that material.
All right, so Karina, I know you're going to do a poll, but I wanted to just remind people, you'll notice that we're speaking very clearly and slowly, and this is because of the closed captioning. We want to make sure that we capture as much as possible and do it in a manner so that the closed captioner can capture everything you're saying. All right, Karina?
I can do that at a later time. You can go ahead and start.
Okay, sure. Next slide, please. So you're joining us on our 4th of 7 trainings. As I said in the prior slide, we went through a handful, almost 6 or 7 different standards. Today we'll focus on 2 really big ones. So if you wanted to learn more about other standards that relate to COVID-19, please refer to those. We will be making those recordings available in the future. We have 3 more trainings to go. Please join us, register. In our last 2 trainings, we'll be having experts from the field to present on disability rights, workers' compensation, and public benefits. In the next training, my colleague and I will be talking about wildfires, which you know is starting to occur, as well as indoor heat standard. So next slide, please. So introductions, I want to let my colleagues introduce themselves. We didn't put a little picture in here for Karine, but I do want to make sure she introduces herself. My name is Jora Trang, and I'm the Chief of Staff and Equity at WorkSafe. Maggie?
Hi, I'm Maggie Robbins. I'm the Occupational and Environmental Health Specialist at WorkSafe.
Hi, I'm Kadeen Humphrey, and I'm a staff attorney and helping coordinate the summer series.
All right, next slide, please.
Come on, it's not.
Well,
Sorry about that.
I'll start. So for those of you who don't know who we are a statewide nonprofit. We are WorkSafe. We work to prevent worker illness, injury, and death by bringing justice to the workplace. And we do this through multiple avenues, one of which is legal services, of which your this training is a component of that, and that is legal advocacy skills, capacity building through trainings, technical assistance, providing some consultation. We also engage in coalition work across the state to advocate for workers, and we do legislative and administrative advocacy, as well as engaging with state agencies. Next slide. So please feel free to visit our website. We have multiple resources on our website, so you can learn more about us. Next slide, please. So today, what we're going to cover is a brief overview of the standard setting process in California, so you kind of understand what it looks like. And we often engage multiple organizations to help us push standards forward. These are so important to protect workers' rights, especially as you all have seen under the pandemic. They're extremely important to ensure that workers have protections in the workplace from injury, illness, and death. We're going to talk about the Aerosol Transmissible Disease Standards, or the ATD standard. We'll talk about workplace violence prevention standard for healthcare, and then other workplace violence in general industry standard proposal that is up for consideration. Next slide, please.
So before we get started, I'm going to deploy a couple polls to make sure that we're, presenting, material that is that fits what you're looking for. So the first poll I'm going to launch now, it asks, who do we have here today? I will give people a couple more seconds. Okay. So it looks like we have, again, a lot of worker advocates here today. Welcome. We also have quite a few attorneys, varying years of experience, and any others, feel free to chat, who you are and that you're here today. Another question that we wanted to ask was what you have the most experience in related to topics we will discuss today, and you can choose more than one option. I have now launched the poll. We'll give people a couple more seconds. It helps us make sure we give you the types of webinars you're interested in. Okay. And it looks like we have a lot of folks with employment law experience and a lot of people here to learn as well. Thank you for answering the polls and sharing this information. So I will go over the case study that I sent out last night, just a few key facts before we get started. So in this case study, Maria is Filipinx, their pronouns are they, them, and is a nurse at Boar Hospital. They are not given N95, but other doctors or clinicians have N95s when interacting with the same patients. Boar Hospital is using a new disinfectant that smells strange and irritates Maria's eyes. Maria's supervisor makes comments about their ethnicity and calls Maria her. When Maria goes to the grocery store, Steve is cashing them out. During his shift, there are always people coming in and he doesn't have time to wash his hands. Next slide, please. Steve does not have access to gloves and masks except once a day. The store does not have plexiglass shields. As Steve checks Maria out, they see Twee, pronoun she, her, a current coworker, enter the store. It is not Twee's shift. Kate, the door monitor, has a personal relationship with Twee, and the two have been fighting. Sometimes the fights become violent with Twee as the aggressor. Their fights have spilled into the workplace. Kate asks Twee to don a mask before entering, but Twee takes the request personally and throws a cantaloupe at Kate. Steve has no idea what to do. There are no policies, and he hasn't been trained on how to handle a situation like this. Maria starts to film the exchange. Next slide, please. So some significant issues and areas of concern, including a couple we'll talk about today, are temperature check and other screening measures. There is a problem with effective personal protective equipment, that Maria is working with COVID positive patients at a hospital, which means their protections fall into the ATD standard. There are also issues with workplace violence prevention and training on protocols and control measures, also inadequate supervisor support and safety, just to name a few. I'll pass it over to Jora now.
All right, next slide, please. Okay, well, thank you, Kanine. We'll be referring to the case study as much as we can during this training. So hopefully you've read it in full. We just kind of wanted to give you a recap so you know what we're talking about. In the past trainings, we have talked more in depth about this, in particular the last one, but I wanted to give you an overview before we jump into how you create a standard. So in general, you all have heard the main state agency that we've been dealing with has been Cal OSHA, and that is because Cal OSHA is tasked with ensuring the health and safety of workers in California. So think of Cal OSHA the way you would think of any kind of government system. It has three separate branches. The one that we've been engaging in the most is the enforcement branch, which we tend to refer to as Cal OSHA or DOSH. It is the Division of Occupational Safety and Health, and it is part of the Cal OSHA system that's responsible for enforcing health and safety laws. So if you filed a complaint, these are the folks that would come in with inspectors, with kind of a team of folks with some expertise to inspect the work site and or respond to a workplace complaints through letter responses. They're the ones that will ultimately cite on the workplace if there are any violations. The next is the legislative branch, which we'll kind of focus on today. That is the Occupational Safety and Health Standards Board. They're tasked with adopting, amending, repealing OSHA standards, and there's quite a lengthy process that goes into that. But they're like the legislative branch of this system. The next is the judicial branch. So after an employer gets a citation, for example, they have the right to appeal that citation. If they appeal it and it doesn't get settled out, just like any other litigation, it can potentially go into an appeals process hearing, and that would be heard by the Occupational Safety and Health Appeals Board through a kind of administrative appeals process. So with that, I'm gonna let Maggie take over and present with regard to the standards.
Hi, everybody. So I'm going to give you a high-level overview of how standards get set. And as Jora has introduced, there's different entities out there that do that. I think people are often accustomed to an agency that enforces rules, writing the rules for themselves, but that's not the structure we have in California. So the Occupational Safety and Health Standards Board is sort of a quasi-legislative board. It discusses and has public meetings that debate and discuss and make decisions around safety and health standards. The members of the board are appointed by the governor, and they fill a specific role. So 2 of them are management people, 2 of them are labor people. There's 1 occupational health and 1 occupational safety member, and 1 member of the public. This on the slide, it's showing the role that the board has for itself to adopt and maintain occupational safety and health standards, to consider petitions for new or revised standards, to grant variances to standards, to be a review body if somebody's adversely affected by DOSH's decision around a temporary variance for a standard, And then they hold public meetings monthly where the public can speak to them, and it's also where they gather input about standard proposals. The board's policy is that all standards need to meet these criteria listed here of being enforceable, reasonable, understandable, and contribute directly to the safety and health of California employees. They apply this to all their standards, but there is another way that some standards get adopted that are basically they're basically a straight pass-through of federal OSHA standards into the state standards. So those have a somewhat different process, and it's more of a direct pass-through. All of this process is governed by the Administrative Procedures Act. In general, standards are initiated in one of three ways. Either staff of Cal OSHA or the board might recommend a standard be considered. The legislature sometimes will direct that they consider a standard, and alternatively, the public may petition the board for a standard. The board determines necessity for that standard, so they get recommendations from Cal OSHA as well as their own staff about the need for the standard, the nature of the risk and the hazard, existing rules that might apply, and whatnot. And then after that analysis, they'll decide whether or not they will proceed with the formal rulemaking process. Generally, they use what they would call the advice and recommendations of an advisory committee, and pretty much that's anybody who wants to show up. So it could be an employer, an industry group, labor union, workers, or members of the public who have an interest and can give their input to that advisory committee about the nature of the hazard, what the language ought to say, scope, things such as that. And in an area where they're putting a rule forward that relates to something that federal OSHA has a standard for, federal OSHA requires that a state standard be at least as effective as, and so they will send proposals to OSHA for their review to get their determination on whether they think it is as effective as the federal rule. And just a bit more background, WorkSafe is pretty active in this rulemaking process, and a couple of, we have several times over the years submitted petitions to the Standards Board to consider regulations. Two of them that are now in front of the board. One of them is related to wildfire smoke, and if that's a very interesting one actually, and we'll be talking about that at the next class or the next workshop. And the other one we're involved in relates to the theme of all of these sessions, and that's about COVID. We filed it in May. It is currently under consideration by Cal OSHA and board staff about whether or not they will recommend that they proceed to rulemaking. So if you want to watch the rulemaking process from start to finish, you can join us in that and get our updates on it and see how the process plays out. What I'm going to talk about now is the one standard that California has that is unique in the country, actually, and it's the only one that directly requires protection of workers from infectious diseases such as COVID. And it's called the Aerosol Transmissible Diseases Standard, and that's such a mouthful that I'm just going to call it the ATD standard after this. And one thing to note about it is it requires programs, employers create a program around prevention of transmission of these kinds of diseases. And the structure of this standard is going to be similar to many other standards that you'll see out there that require a program. So it's fairly complicated, but there's a lot of commonality between it and other program standards. So what is this standard's been around, this standard's been around for about 10 years. It includes requirements to protect workers from diseases that are transmitted by aerosols. An aerosol is a suspension of very fine particles or droplets in the air. They're light enough that they float with the air as it moves around the room, as opposed to settling out by gravity to surfaces below. And despite a lot of apparent uncertainty that you might have read about in the media about is COVID airborne or not, the way the standard is written, COVID would actually be covered as an airborne disease because it is a novel or unknown pathogen. And there's an appendix in the standard that lists what are covered diseases and novel and unknown pathogens are covered as airborne transmissible until you have clear evidence that it's not. Then at the last bullet here is a listing of a guide that will help walk you through this standard if you want to know it in more detail and to understand background. We're not able to cover every aspect of this standard. It's quite complex, actually. So there's two slides, sorry about that. There's two slides here relating to scope. The one that we most think of is healthcare employers. And most of the obligations under this standard are aimed at acute care hospitals who are treating sick and ill patients, but it does also apply to a lot of other medical settings, including paramedics and emergency medical services, people who transport patients, long-term care facilities, and others. A second grouping of employers that are covered, sorry about this, I just keep hitting my buttons. Okay, so other types of employers also have obligations under the standard, and they're a disparate set here, but it would include people who might transport suspected COVID cases, people who might receive patients coming from a hazard material release, which could include a biological materials release. It could be people who do public health work, such as contact tracing. There are other high-risk settings where transmissible diseases might well be present, as that are listed there. There's people who have unique jobs that might expose them to pathogens, such as pathology labs who might be looking at doing analysis of tissue samples or sputum, people who handle cadavers, people who repair and maintain air handling systems, and people who deal with animals. And I know you've heard a lot about how COVID may have passed over from animals to humans. And so there is actually a separate subpart of this standard that is directly related to the people who handle animals in the US to try and prevent a similar thing from occurring here. So what must an employer do? In general, they have to establish what we call an ATD exposure control plan. They have to train workers. They have to provide appropriate personal protective equipment. They need to provide medical services to workers. So for example, if there's something for which there's a vaccine, that they make that available, that they do surveillance for illness, that they would do follow-up if there were contacts where you might want to determine if somebody's been infected and such as that. And then they also need to keep records about what they're doing in the program. I'm going to spend a few more slides talking about the details of this exposure control plan. The exposure control plan spells out the employer's analysis of what work tasks and which workers are at risk of exposure to an aerosol transmissible disease. It lays out the preventive measures the employer might implement to try and prevent workers being exposed. And it basically provides a roadmap of all the actions that the employer intends to take or commits to take, I would say, to prevent exposure to people on the job. So it includes things such as identifying who administers the plan, that is, who's responsible for making sure that it actually is carried out. Lists which jobs have the exposure, lists which procedures they do that might cause them exposure, list the assignments or tasks for that you might require respiratory protective equipment or other types of personal protective equipment or PPE. It has to include how you're going to try and prevent sources. That means people who are infected who might shed this virus into the environment. So how you're going to control them so that they don't shed as much into the environment. And it requires that they really lay out a lot of the procedures and processes and equipment and tools that they'll put in place to reduce exposure. The first one here is in a way the most important. It's about identifying and isolating people who may have an aerosol infectious, an airborne disease, sorry. And if you can identify them quickly and isolate them, then that is one way to prevent everybody else in a work environment from potentially being exposed to them. The plan has to go into detail about precautions that we put in place when patients are not in an airborne isolation room, as well as the precautions that are in place when they are in that room, because people must go in and out of that room, workers must go in and out of that room in order to treat that patient. The exposure control plan also has to outline what medical services are provided to employees, such as testing, such as health follow-ups, things like that. How they'll determine if there's been an exposure incident so that they might need to do follow-up, and to determine how much somebody might have been exposed if there was an exposure incident. And all those are important for helping determine how you respond to the exposure. And yet more procedures they need to have in place. So they need to communicate with employees. They need to have an adequate supply of PPE and other equipment that's needed in order to care for these ATD patients safely. And I'll talk a little bit more about this later, but they need to have enough for normal operations and for foreseeable emergencies or surges in demand. They have to do record keeping, as I mentioned before. They need to do training of employees, and they also need to have active involvement of employees to review and update their plan and make sure that it is still relevant as times change. And if you were on our earlier workshops, we talked about the hierarchy of controls, that some types of controls are more effective than other types of controls, that engineering controls are the most effective, that work practice controls are intermediate in effectiveness, and that PPE is generally less effective. So this standard actually reiterates that point, saying that employers must use feasible engineering and work practice controls to minimize employee exposure, and that where those don't provide sufficient protection, then personal protective equipment can be used. We're not going to do a tutorial about respiratory protection types and the differences between them. That's another whole, we could spend another whole hour on just that question, or at least a half an hour. But what I will say is the standard does require appropriate respiratory protection be used where exposures may be occurring. Listed on the slide are some of the situations which that needs to happen. There are different types of respirators that require different levels of protection. And so if you ever need to delve into this issue more carefully, it would be worth it to go to NIOSH or OSHA's website and look for resources that will explain for you the different types of respirators and which ones are appropriate for what kind of settings. One thing I will note is that if workers are doing an aerosol generating procedure, as listed on this slide, they actually required to have a type of respirator called a powered air purifying respirator, or PAPR. Whereas in other settings, a filtering face piece N95 is sufficient. And the last slide here is about the surges. The standard anticipates that there are surges, that is increased need for dealing with an airborne infectious disease. And it stipulates that the employers should have procedures for dealing with that. Including having appropriate levels of PPE to respond to a surge. And I guess the one thing we've been seeing in the news since then is that at sort of all levels, our healthcare system has, and state emergency response system has not adequately planned for this very predictable type of pandemic that we're now in the midst of. So that was a real high-level overview, and I guess now we should take a few questions if there are any coming through.
Does an employee have the right to request a copy of the entire exposure plan?
I would say yes. You should be able to get a copy of it. In general, these standards have the ability for workers or their representatives to get a copy.
And I do not see any more questions right now, but feel free to put any questions you have in the Q&A function and we can address those. later if they come up.
All right, great. Thank you, Maggie. Next slide, please. So what I'm going to talk today about is workplace violence, specifically. Can we, next slide, please? So many of you have seen some of the viral videos that have come out of folks angry at the grocery store, tossing and throwing groceries because somebody has asked them to put on a mask. It's a very high tense environment right now, and workplace violence, which has always been a problem, I think is one of the standards that we should really be focusing on because of the potential for things to erupt. So I'm going to talk a little bit about workplace violence, the definition, and then go into the different standard that protects healthcare workers specifically. So a definition of workplace violence that was laid out by OSHA is that it is any act or threat of a physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the work site. And it ranges from threats and verbal abuse to physical assaults and even homicide. And I'm gonna go through different levels across that spectrum. Next slide, please. So every year up till last year, WorkSafe puts out a report called Dying at Work, and that report often takes information that is a year back or 2 years back, because that's when the information is available and we process that. And last year, in our report, after analyzing data, we found that violence was the second leading cause of workplace death, which is extremely concerning. In 2018, 92 workers were killed, which was 22% of occupational safety and health fatalities in California. 62 of the deaths were homicides, and more than 2/3 of these involved gun violence. Violence continues to be the leading cause of workplace death for women in particular. 15 of the 38 women who were killed at work in 2018 were victims of violence. That's more than 40%. Next slide, please. So for California, women in California, violence is actually the leading cause of workplace death, 39%, followed by transportation, which is 26%. So domestic violence and intimate partner violence often spills into the workplace. From 1997 to 2009, 321 people were killed by intimate partner in the workplace. And 44% of working US adults have experienced some kind of domestic violence, the effects of domestic violence in the workplace, either as a coworker or as a victim. So next slide, please. So here are some examples of workplace violence, just so that you can have perspective. A healthcare worker who is physically attacked by a patient, an employee who harasses, threatens, or stalks another employee with whom they've had some kind of prior intimate relationship, a survivor of domestic violence that has fled their abusive relationship and is now being followed by the abuser at work, an employer's ex-boyfriend incessantly calls and visits the employee during shifts. Upon receiving divorce papers, the man shows up to his wife's office and kills her and several of her coworkers. And as you all have seen, some of the incidents of workplace violence that we have seen now are retail customers becoming quite agitated or upset at retail stores or any other kind of service-oriented store, requiring that they wear a mask or engage in health and safety protocols. Next slide, please. So let's talk about the spectrum of violence. We can understand workplace violence as happening along a spectrum from low to middle to high. Workplace violence can include threats or acts of violence that have the intention to harm or intimidate. They also include acts that are meant to intentionally cause physical injury or emotional and mental abuse. Workplace violence can be perpetrated by coworkers, supervisors, customers, clients, patients, intimate partners, and any other person who commits or threatens to commit a violent act at the workplace. Next slide, please. So when we are talking about workplace violence at the low end of the spectrum, we are talking about abusive, hostile, disruptive behaviors that can create anxiety and or distrust in the workplace. These behaviors constitute violence, but alone often do not constitute criminal behavior. and consequences for these may include warnings, documentation of incidents, etc. Employers who should pay special attention to escalation of violent behavior. Employers should pay special attention to this, because oftentimes high incidence of workplace violence have a root at the low end. So in our case study, TWE has some history of tension in the workplace and sending, I believe the case study was disruptive messages or texting to Kate during the workplace that was harassing or belligerent. This might be a sign of on the low spectrum of workplace violence, and definitely should be taken note of because it can escalate. So next slide, please. So when we move further along the spectrum of workplace violence to the middle ground, we're referring to words or actions that are reasonably perceived to be intimidating, frightening, threatening, and that generate a justifiable concern for personal safety. So in our case study, when TWE threw a chair at Kate, that was an incident that occurred in their home, but it is an example of what a middle level threatening act may look like. Similarly, TWE also threw a cantaloupe at Kate when they were in the store. So threats to inflict bodily harm or destroy personal property, monitoring the physical whereabouts or surveying somebody, otherwise known as stalking, repeatedly telephoning someone, waiting outside a person's home or workplace are all examples of middle level workplace violence. Next slide. So examples of high. Lastly, the high end of the workplace violence spectrum includes the infliction of bodily harm or intentional physical contact. Almost all of the behaviors are criminal in nature and should involve law enforcement. The most serious type of violence is homicide, but pushing, shoving, kicking, biting, etc. all fall into the high end of the spectrum. Next slide, please. So now that you kind of have a basis for what I'm talking about when I talk about workplace violence, I'm going to talk about the workplace violence in healthcare prevention standards specifically. So next slide, please. So workplace violence in healthcare is a very, very serious problem. So as of right now, a lot of the media focus has been on the potential exposure of healthcare workers to COVID-19, which is really real. But there is also this serious concern of workplace violence that has always existed in healthcare that we should also take into account. So here's some just some basic information about this condition. So in 2017, registered nurses reported more than 3 times the rate of injuries due to workplace violence than workers overall. There was also a survey of hospital employees, and 62% reported that they were the target of violence within the last year. More than half of healthcare workers experience at least one incident of physical or psychological violence during their professional career. Assaults against healthcare workers in the United States represents nearly 70% of non-fatal injuries. So since the workplace violence and healthcare standard was passed, which I'll tell you a little bit more about that in a sec, healthcare, the different employers, facilities that are in the scope have to report to Cal OSHA all incidents. And in 2017, 23,000 incidents of assault were reported. This does not take into account all the other incidents that might not have been reported to Cal OSHA specifically. So next slide, please. I wanted to share with you a more visual representation of what this looks like across other industries. Healthcare workers are 16 times more likely to experience violence than any other service worker. They are the green line that you see here. Others are the blue, which is private industry, orange, which is, I can't see it, oh my gosh. Well, you could see it probably better than I am. I'm having some vision issues here. Retail trade, there you go, and construction and manufacturing. As you can see, there's a huge gap between the level of exposure to workplace violence that healthcare workers have as opposed to everyone else. So next slide, please. So the workplace violence and healthcare prevention standards started with the passage of SB 1299 in September of 2014. The campaign was fueled by the death of a nurse, Cynthia Palomada, who was attacked and killed by a patient at the Martinez detention facility. So this is horrific that someone, in this case, Cynthia, was attempting to provide medical care or assistance to somebody only to meet her death. So this bill directed specifically the Cal-OSHA Standards Board to create the Workplace Violence Healthcare Prevention Standard. And it took nearly 2 years to be able to do that. So I did want to note the time gap here. When something happens and you want to pass legislation about it, it takes some time to go through that whole process. And then once you go through that whole process, it takes the standard board, quite a bit of time, probably in this instance, 2 years, to go through everything that they need to go through to pass it. So when you are strategizing about trying to create a new health or safety law, the best mode to do that actually is to create pass first some kind of state mandate through legislation. Because the state mandate, all it does is say, the Senate bill basically all said was, Cal-OSHA, you guys go now create this standard and you have 1 year to do it, or usually set some kind of date. When there's a date set, Cal-OSHA is more, is kind of put to the fire. They must go through the series of steps that Maggie detailed to create the standard, but they must do it in a timely way. When they do not, are not mandated by some kind of timeline, which I'll share with you in a sec, it's a much slower process, and it's kind of harder to push them to grind, on this. So after the October 2016, California healthcare employers were then required by law to have a comprehensive unit-specific workplace violence prevention plan. And so I'm just going to go through a little bit of what that plan might entail. So next slide, please. So the scope of the facilities that are covered included general acute care, special and psychiatric hospitals, skilled nursing facilities, intermediate care facilities, and congregate living health facilities, correctional treatment centers, hospice facilities, home health care and home-based hospice, emergency medical services and medical transport, drug treatment programs, and outpatient medical services to the incarcerated. Next slide, please. So what are our employers supposed to do? So you might see a general trend in some of these standards are laid out. Employers have to establish a clear process for employees to report all incidents and threats of workplace violence. That means that there has to be some kind of procedure if an employee wants to report. Who should they report to? How are they going to do it? What kind of form do they use, if there's a form? The employer must engage the active involvement of employees on workplace violence risks. You got to go talk to your employees. They're the experts about what's going on, to ask them for their input on how and where they are experiencing workplace violence. You got to talk to the employees about the selection of the most effective way to prevent violence, to develop procedures required under the standard, and to develop and administer training. The employers must also develop a transparent plan to respond effectively and immediately to all workplace violence incidents. They must also record every workplace violence incident, regardless of whether an injury occurs. And this is for the same exact reason that I was speaking of before. Along the spectrum, oftentimes you can hopefully prevent a more serious injury along the high spectrum if you already are keeping track of the low and the middle, and you are actively engaged in figuring out what to do. So the next slide, please. So training is so very important under this standard, and you cannot meet this training requirement by simply doing a training and then being done with it. There are 3 categories of training, and each category is important. There is the initial training, which should be provided for all employees who work in the facility and should cover the employer's specific workplace violence prevention plan, how to report incidents, etc. There is the refresher training, which should be done at least every year, and should be provided to employees with patient contact activities. It should review the initial training as well. And most importantly, there is a responder training, which should be provided in person, can't be video, can't be by, well, now we're going to have some issues with COVID-19, but it must be provided in person. And it should be provided to employees whose assignments involve responding to alarms or confronting, controlling persons exhibiting aggressive or violent behavior. It needs to include ways to de-escalate, physical maneuvers to diffuse and prevent violent behavior, and it has to include opportunities to practice. How many of you have engaged in some kind of physical class, self-defense, sporting, you know, anything? You can't learn something from watching a video or from reading a book. You must engage in it physically, practice it, see how it works out with you, how best work, you know, how to best use your own physical abilities, and to ingrain muscle memory. Next slide, please. The employers, ER stands for employers, sorry, shorthand, must engage in the prevention of workplace violence by making sure that there's sufficient trained staff to respond immediately to workplace violence without conflicting job assignments. They have to create a plan to prevent the entry of weapons into the facility. They have to install, implement, and maintain an effective alarm system. And they have to ensure that the parking lots and walkways around the facility are safe, well lit, all that. So next slide, please. So after the workplace violence in healthcare standard was passed, Cal OSHA then was the agency that folks reported to around about incidents, and Cal OSHA released their report about 2017-2018 reported incidents recently, and this is just a diagram of that report, which I believe just came out. 40% of workplace violent incidents occur in inpatient units, 27% occur in the emergency department. Hospitals reported employee injuries in 43% of all incidents, and the most common injury was some kind of bruising or abrasion. Patients make up the largest percentage of aggressor types, 93%. Is that 30? 93%. So this kind of information and record keeping and reporting in general is extremely important, because from our perspective, we can look at this from the outside and see where are the areas that need some further development. And from the inside, hospitals can take or healthcare facilities can take a close look at what is going on and to adjust their current standard, their current policies to ensure worker safety. So next slide, please. If there are any questions, I'm going to invite Maggie back to help me with this. Are there any questions, Karim?
Not yet, but if anybody has any questions, you can go ahead and put them in the chat now, as everybody is muted for the webinar function, or you can put them in the Q&A function on the bottom of the screen.
I guess the one thing I would add is that in the way that Jora was breaking out violence, there's different, I guess you might call it sources. And some of them were identified as you might have a patient or a family member, you might have a stranger coming in, but in healthcare, as in other work settings, you also might have people who are coming in who are intending to rob, for example, either to steal money because there's cash changing hands in healthcare facilities, there's valuable equipment and materials, and of course drugs. And so sometimes it's not somebody that you know, that you work with, or that's a family member or a relative. It is actually a stranger who's coming in with an intent to do harm. So there's different facets to that violence prevention, depending on the nature of who and why you think somebody might be committing violence.
Thank you, Maggie. So I don't see any questions. Please feel free to email us, So let me move ahead with the next slide, please. So now that I've talked to you about the workplace violence in healthcare, I'm going to talk to you about what we call the workplace violence in general industry. And this is a proposed standard. It would apply to general industry, meaning every other industry besides healthcare. And this is a perfect example of what happens when a workplace, when you try to create a standard that for which there is no legislative mandate. So WorkSafe and our allies and in coalition started working on the workplace violence and prevention standard October 2016, right when the other one passed. It is now the year 2020, and still we have no workplace violence and prevention standard, despite the fact that it is a huge problem in California, let alone the rest of the nation, being the second #1 killer of folks in the workplace. Next slide, please. We will be actively continuing to work and push on this slides, and so we welcome all organizations and folks who can come forward and share stories. So low-wage workers are more vulnerable for workplace violence, especially sexual assault, domestic violence, stalking, and trafficking. 2/3 of low-wage workers are women in industries such as retail, hotel, restaurants, agriculture, hospitals, clinics, private residences, and farms. And many of these folks work in isolation, which makes them more vulnerable to being subject to attack. Next slide, please. These are just some statistics I gathered from our allies. 60% of women in the restaurant industry, 58% of hotel workers, and 80% of farm workers have experienced sexual harassment in the workplace. Next slide, please. 19.3 million women in the US, next slide, Maggie, have experienced stalking in their lifetime, but more than 50% of stalking victims are reported being stalked in the workplace. Next slide, please. So I'll walk you through just a couple of components, what we're fighting for right now in the workplace violence regulations. We don't want exceptions for small employers. We want to make sure that there is an injury and illness prevention like elements. So the injury and illness prevention plan is a plan that allows folks to set forth different protocols to ensure a way to identify and fix hazards. Such as identifying the hazard, knowing who exactly to go to, how do you investigate it, how does an employee talk about a hazard without getting retaliated, and then what do you do to fix the hazard after. We want to, in particular, designate some way for employees to report to someone other than their direct supervisor, just in case their direct supervisor is the harasser or perpetrator. We want to ensure that there's periodic review after every incident of workplace violence, which results in an injury. And again, this is because of the fact that workplace violence occurs across the spectrum. So if you know that there has been incidents of low workplace violence, you must, the employer, you've kind of gotten a heads up. You need to then figure out what to do to not have a higher level of workplace violence after that. Next slide, please. We want to make sure there's a mutual plan of implementation when there's dual, joint, or multi-employer work sites. So many of our work sites nowadays have dual or joint employer situations. There might be a temp agency or a staffing agency. There might be a host employer and then several other employees that work within that. Active shooter threats is a huge problem in California and the nation, and so there needs to be a plan on site for that. For those of you who have children, you all know that many of us, our kids who are in school, are actually doing active shooter drills, not just the fire drills, but active shooter drills. So a workplace violence standard that lays out something like that, protocols around how to prevent that or prepare for it. We really want a violent incident log. Again, you want to make sure that employees feel comfortable providing information without feeling retaliated, but we really need to know when there are low incidents, incidences along the low spectrum, again, to ensure that we prevent anything from escalating. And that is the end of my presentation for this. I want to move into the next slide, which is Q&A, to see if anybody has any questions. And we have 3 minutes left for any questions before I close out. I see none. Catch me as I'm going along. If you think of something, we will be, next slide please, sending an evaluation out. This evaluation is so important to us. We really care about what it is that you need, how best to make sure that this material is important to you and applicable to you. So please take the last 5 minutes to fill out an evaluation form. Karine is going to be sending you a link, I believe.
Yeah, I can put it in the chat as well.
That would be awesome. So while she's doing that, I want to tell you a little bit more about us before we break. So next slide, please. So we have lots of active campaigns going on. We welcome your participation in any one of them. So please email me personally, jtrang@worksafe.org. My email will be up in a little bit if you want to learn more. We have had a group of folks come together to look at the best practices for California's workers, for protection for California workers, not just in occupational safety and health, but also for paid sick leave, minimum wage. You know, we want to make sure people get paid. We are also connected to at least Alameda County's Department of the Alameda County they have set up various task forces to try to figure out the best ways to address the issues in this county. So just send me an email if you're interested in joining any of our coalitions. Next slide, please. So this is an example. This is a very short 1-hour training that where we collapsed a whole lot of information into an hour, but all the information that we provided can be expanded out and done in a much more in-depth manner with interactive methodology and training. So if you're interested in having a much more in-depth training about your specific industry or your worker center, please contact us. We're happy to engage with you. We are in the process of developing a bilingual training or monolingual Spanish training right now. So if you're interested in that, please contact us. Next slide, please. So again, this has been the Jora and Maggie Show. Thank you for joining us. Please feel free to email us with any questions and sign up for our next 3 workshops. I think I'm done. Anything else, Karine, before we're done?
That's it. Thank you, everybody. Again, if you do not get an email from me, if you did not get one last night or you do not get one with the slides, it means you would have to email me first. I've had a couple issues with people's work servers not allowing my email to be sent to you. So that means you would have to email me first in order to get those materials. Thank you.
All right. Thank you so much for joining us. We hope to see you in the next few trainings. Bye-bye.